Hi folks, I'm Dr. Fazil. You're watching Dr. Fazil TV show, 2025 edition of month of July. Folks, I'm also an internal medical specialist as well as a kidney specialist and nephrologist, medical side of the kidneys and bladder. So my topic for discussion today is based on your questions and multiple clinical scenarios I see in my daily practice. And it's one of the common question is that the patients say, hey, I have an abnormal urine, looking like an abnormal urine, or it doesn't look normal to me, so what could be the source, And obviously, urine is a system of the kidneys to get rid of your waste products from the body, right? I mean, we get rid of the waste products through the stool, also through urine. So obviously, anything we change in your body, internally that can change the look and smell and the color of the urine. At that time, we do a urine analysis, urine dipstick and urine dipstick, and you can see in the hologram right here, this is, urine being dipped, and I mean, that's kind of easy way, but obviously sometimes it's done by machines. So the normal urine looks like light yellow, no smell. So let's talk about the color. The color could change if you're dry, dehydration. So when there's less water, all your pigments in the urine will become more prominent, so it will look more yellow. So yes, if you think you're dry, you should drink more fluids. The other cause is smell. Like if the smell, it could be infection, urinary tract infection. It could be a bladder infection. So if that's the case, if the urine will show something we call nitrates positive and the leukocyte esterase. The common elements, and this is a urine stick. You can see that a nitrate positive, leukocyte esterase positive. So that shows the infection, and if there's mostly you treat it, especially if you're elderly or have diabetes, that need to be treated, because if you don't, it can spread to your kidneys and to the blood and cause something known as sepsis, obviously. So it's important to keep an eye on how your urine look like. And sometimes it could be due to certain, smell could be uncontrolled diabetes, it can cause a fruity smell in the urine, that is ketones. When you have high sugar, it can cause ketones, like a fruity smell in the urine, so that could be a sign of that. And smell change. Color change could be also medications. A lot of medication, pyridium, for example, is being used for UTIs, pain, urinary analgesic. It makes urine look like red. Blood in the urine by itself, even a drop, can cause bloody urine, and it can become very pinkish. So that's the important finding. So it's like, urine is known as a poor man's kidney biopsy. So a kidney specialist can find out a lot about your body through looking at the urine. So if you find that urine is abnormal, you should talk to your specialist or see a kidney specialist. So that could be early warning signs. So blood in the urine could be due to a tumor in the bladder, in the kidney, or infection, or kidney stone. So yes, that's important. Foamy urine, right? Let's see another picture right here, a hologram. You can see the urine, it has a little foam on the top. That could be due to protein in the urine. You're not supposed to have a lot of protein in the urine. It's held in the blood as the kidney filtrates the urine. But if you have too much foamy urine, that could show early damage to the kidneys. So that's obviously need to be investigated further to prevent ongoing damage to the kidneys. Because if you lose kidneys, you go on dialysis, or worse, it could be fatal. So obviously it can cause poor health, so that need to be checked.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Yeah, sometimes jaundice can cause, jaundice is a bilirubin, a pigment your blood cell makes when they break down, and they get cleared up by your liver. Let's bring an anatomy here. You can see the blood is going to the liver, and liver clean up the blood, and it go back to your heart, and there's this loop. But if there's too much breakdown of the cells, it can cause a yellow urine. Or if it is a blocked liver and nothing is coming out of that, the bilirubin is not coming out of the normally the bilirubin goes to the stool, right? It goes from the liver into the stool. That's why your stool looks yellow. and the urine looks normal. So if you have something wrong with the liver, it can cause stool to look like white and urine to look like more yellow because it's not doing its filtration process. So that's a very important sign. If you see that your urine is getting more yellow, eyes are getting yellow, and your stool is getting like a more whitish, then that could indicate a liver actually damage or liver issues, which could be due to multiple reasons like liver cirrhosis and stuff like that. So on the like most people look at the urine by the color, by the smell, by the foaminess, and those kind of things. So sometimes you can pass even stone in the kidney. So yeah, if you're doing that, see your doctor or provider, and they can investigate that to see why you're doing that. And if there's stones, they can fix it, or prevent for further episode to happen. Kidney stone can damage the kidneys too, right? It can eat up the meat of the kidney. So that's kind of like a nutshell. I mean, there's more other issues which we can talk about the urine, but that's beyond the scope of this discussion. So folks, on that note, it was Dr. Fazil TV show. I will be back next time with more useful topics and information. Thank you so much for watching Dr. Fazil TV show, and God bless you and God bless America.